Hi everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to talk about under eye treatment. So this is our lovely patient, and she is presenting to us because she doesn't like the way her under eye area is looking. She has had filler in the past, maybe a couple of years ago the first time, and then another filler treatment about a year ago. It seemed like the first one worked better, the second one didn't work quite as well, and now she's noticing even more kind of puffiness under the eye area. So I think there are a couple of things going on here. One is, as we age, that under eye skin is just thinner to begin with than in other parts of our body. So the collagen and elastin levels deplete quicker, and we notice under eye aging a little bit faster than other parts of our face. So it's always good to stimulate that collagen and make it healthier. So we're going to do a procedure called Ultherapy today, which is going to help stimulate the skin to grow new collagen fibers, elastin fibers, and just make it a little bit tighter. There are other procedures we use for that as well, such as ThermiSmooth and Thermage, and all of these are completely non-invasive and are also very helpful for the eye area. My favorite is Ultherapy, so that's what we're going to do today. And then that works over about 4 months, where it continues to get better and better over time. The other thing that we use for under eye areas are fillers, but like I said, sometimes the hyaluronic acid fillers over time can rise to the surface, or they can just start accumulating, being a little too hydrophilic and then looking kind of puffy. And in that case, I actually just like to dissolve the filler and then kind of restart, or maybe choose a different method, such as injecting PRP into the under eye area, which also makes the tissue healthier and can help fill in some of the sinking areas. We can also use threads sometimes, which also stimulate collagen under the skin. So we'll figure out what's going to be the next course of action. But first, we're going to tighten the skin and then get rid of some of the excess filler that's just causing some of the puffiness for right now. We can also do resurfacing procedures such as profractional or laser skin resurfacing that also helps to tighten the area. Do you have any questions at all?
I don't think so.
Okay, is it all making sense?
Yes.
What we talked about? Mm-hmm. Good. So that's what we're going to do. We'll start with Ultherapy. So I'm just going to lay her back. And this is a little bit uncomfortable, but not terrible. Okay, and it's pretty quick. So, and then I can also see that the filler is causing a little bit of a bluish discoloration. So that should get better as we dissolve some of that out of there. Put a little gel under here. Okay, here we go. Ready? Mm-hmm. Okay, very good. Okay?
Yeah.
All right.
Good. I mean, it's tolerable.
Yeah, it's tolerable. Yeah, it sure is. Yeah. All right, I'm going to sit you up a little bit again. And let's see here. Wipe off some of the gel. All right, so now we're going to use some Hyalin X and just dissolve some of the old filler there, okay?